Hi everyone. My name is Yekaterina, but most people call me Katie. And this is my story with the C word. So I know you can tell that I have to be limited in my motion so that you don't get the glare. But usually I wear glasses. So if anyone can give me a tip or tell me how I can remove that and wear my glasses, that'd be great. Because I usually wear them. I'm not blind without them, but I'll just take them off for the purpose of the video, even though it is hiding my moon face. Moon face is when you gain weight in your neck and your face from steroids, which I'm on right now. I will soon be off, and the moon face will go away in a few months. So my face usually is round, but it's not this round. But my glasses did a good job of hiding it. But just to let you know, I am not this round. Anyway, so I'm 25. I graduated with a nursing degree. I live in PA and worked in an ICU. Have a boyfriend, have two beautiful dogs. My boyfriend was formerly in the military, which sparked my interest to go in the military. So in the year of 2017, I got accepted into the Air Force. And the plan was we moved in with a lovely couple into their home for a few months to save some money on rent. And we were going to go to Virginia for the Air Force, for nursing. I was going to be an ICU nurse in the Air Force. But none of that happened. Nope, not one bit. The C word. Just had to ruin some things. Yep. So in January of 2017, I started getting fevers and chills for a week. And I figured, hey, I'm a nurse. I work in the ICU. I'm sure I got the flu. Okay, I'll just tough it out and get over it. And I did. Okay, no big deal. Then comes February, at the end of the month. Again, for a week, I get fevers and chills. I don't know why. As most of the population doesn't want to go to the doctor, and even as a healthcare professional, I did not want to go to the doctor. And also, I work around doctors, so I figured if I just kind of ask them and tell my situation, maybe I can get an insight without having to go see one. Said I had fevers and chills. Nothing else. No nausea, vomiting, diarrhea, no abdominal pain, nothing else. You just probably had the flu. But anyway, I went to the urgent care center, got all my blood work, all came back normal, and they said, well, maybe you just have pneumonia post-flu, or you have a virus again. Okay. So then March and April roll around, and again, at the end of the month, I have fevers and chills for a week, and it happens around the clock. So I have to take Advil and Tylenol, and then I end up having to throw up, and I end up having to have diarrhea, and my symptoms start getting worse. At that point, I know something's off with my body. I know something's not right. Like, I've never been that sick in my life before. I've only been sick maybe a few times in my life. I was relatively healthy. I played soccer most of my childhood. I'm not overweight. I watch what I eat. I'm not the clean bill of health, but I'm also not completely unhealthy either. So I just knew something was off. Talking to some of the doctors that I worked with, they said maybe it's autoimmune, like you should look into it, you should get it checked out. But at the same time, I'm going into the Air Force. Like, I was thinking maybe I'll just stick it out and just, keep getting sick. I remember, ironically, I joked to my boyfriend, I said, well, what if it's cancer? And he was completely flabbergasted. He was like, I can't believe you would say that, like, that's ridiculous, and he just, like, completely brushed it off, and I did too. I didn't think it would be cancer, but hey, you never know. Then, around, like, April-ish, I banged my knee, and then my knee hurt for a few weeks, and I could tell it was taking longer to heal. I knew that was kind of off. And then before Memorial Day weekend, I was working, and I had to take an IV pump from one pole, take it off, and then put it onto another pole. So when I take it off, I put it down in an unstable place. It flipped over and it hit my foot, and my foot got cut open. So I cleaned my foot, I cleaned the IV pump, and I put it back on. I continued working, and I put a Band-Aid on, like it never happened. Then Memorial Day weekend comes, and I can't bear weight on my foot, so I'm thinking, okay, it's just from the trauma, no big deal. The week rolls around, I have to go to work, but it's warm, it's red, it's swollen, and I can't bear weight, and that all points to signs of an infection. So, go to employee health, they send me to the emergency room, and they admit me to get IV antibiotics. And as I'm getting these IV antibiotics, my fevers and chills come back again. And at that point, I'm debating with my boyfriend, like, should I tell the doctors about my history, about, all these months of getting fevers and chills? Should I not? Because typically, when you go in and you have an infection in your body somewhere, they have to prescribe you the right amount of biotics, virals, fungals. And if it's effective, your symptoms go away. They don't arise. So my fevers were getting worse, my chills were getting worse, but they were giving me antibiotics for my foot. So I did end up telling the doctors, like, hey, listen, I had these fevers and chills, and they come in a pattern. They come at the end of the month for a week, and I've been having them for several months. So at that point, I was diagnosed with fever of unknown origin, which means they don't know where your fever is coming from. So that means that in the hospital or wherever you are, they will have different doctors see you and try to rule out and see, like, okay, well, if it's not this, then it might be this. Well, if it's not that, then it might be that. And one of my blood work for my blood cell count, it looks at all your blood cells in your body, and you have basically three different types of blood cells. You have red blood cells, they carry hemoglobin, which carries your oxygen for oxygenation energy. You have white blood cells, they fight your infection, and then you have platelets, which are responsible for clotting. In my blood cells, I had some immature cells, meaning that there were cells that didn't mature into anything that were in my blood. They're not supposed to be there, because your blood is made in your bone, and that's where the immature cells are. And then they mature and they go out, and they're in your body. So that led to a consultation with a hematologist oncologist, which is basically a blood cancer doctor. And he came in, I remember the day, smiling, which I don't know why you would smile about this, and saying, hey, well, you really need a bone marrow biopsy. I mean, we can do a blood test to see if you have anything, but we need to do a bone marrow biopsy to see if you have any kind of blood disorder or if you have leukemia. I was completely in shock. My boyfriend was even more in shock and actually pretty angry with the bone marrow biopsy. FYI, bone marrow biopsies are horrible. Just absolutely horrible. If there is a way you can tell if someone with blood cancer is in remission, it's not a bone marrow biopsy. Please disclose it to the world. Please. It is horrible. It is a biopsy of your bone marrow. It is a biopsy of your bone. So basically, they drill a hole in your bone to get blood and to get a piece of bone. It is painful. It is freaking painful. No matter how much they numb you up, I suggest you get a strong pain medicine. Whatever is strong for you, whatever you're comfortable taking that is strong and that you can take safely, take it. Honestly. That is my biggest recommendation for anyone who's getting a bone marrow biopsy. They are horrible. Because, yes, they used to do, actually, I learned they used to do it in your sternum, which I don't know how they would do that. I guess you would be laying on your back, and I guess your face would be covered, but now they do it in the back of your hip. But you lay on your side, they clean you up, they numb you up, and they put a big freaking needle into, and they drill it into your bone. Yeah. So the numbing agent's, in your skin and your muscle, but it's really not in your bones, so you feel it. And it hurts. And you're sore for a few days. And it's horrible. Because I thought you just got it once. The bone marrow biopsy, no. No. It's an evaluator to see, are you in remission? Do you have a blood cancer? It is done pretty frequently. And no, you are usually not sedated as an adult. Maybe as a child, I'm not sure. But as an adult, you are not sedated. And it's horrible. And it's painful. And it sucks. And it hurts like hell. And especially where you have to go for your checkups is far and you don't have someone to take you, they're not going to give you anything strong. Oh, we'll give you Tylenol when it's done. No, I wanted something now for it now because it's going to hurt now. And every time I get it, I scream. I mean, I'm not the best with pain, but there's literally a drill of a needle going into your bone, and it is horrible. Every time I go to my cancer support group and I hear other of my fellow friends talk about, hey, I need to get a PET scan, I need to get a CAT scan, I need to get an x-ray, I am very envious because, I mean, for some people that have anxiety around enclosed spaces, you know, I don't understand that, and I apologize, and you know, I feel bad for that scare that you have of being uncomfortable in that environment. But I would give anything to have an x-ray or a scan, just a scan, not a biopsy. Like, it just sucks with blood cancers because that is where your blood cells are made in your bone. So that is how you can tell if you have something wrong going on in there. But it sucks. It hurts. And it's done all the freaking time. Every time my heme-oncologist tells me, well, this is when you need a bone marrow, I don't give her an exciting response. And she knows that it's not fun. Nope. Mm-mm. Mm-mm. Out of everything that I've learned through this is I've experienced some things as a patient that has made me further empathetic as a nurse. Because some of the things that you don't really know, you really don't know how it feels until it happens to you, and it's horrible. But anyway, got the bone marrow biopsy done. I guess on that Monday, and then on Tuesday, June 5th, found out I had acute myeloid leukemia. It was a horrible day. I don't remember the day, but I can already remember how I felt. I was in shock. Just complete shock that I had leukemia. You know, I was in shock. I guess the first reasonable question anyone would think of when they get a diagnosis like that is, why me? Like, why did I get dealt this card? Why me? And that's something I still ask myself sometimes. That's another topic to talk about, but it's something I struggled with for a while, was why me? That was a big question. But that turned into something else. That turned into try me. That's how my attitude changed about that, was why me? Why feel bad for myself? Instead, try me, cancer. Just try to break me. Try. That's how that changed. But I was at the hospital that I worked at, and my boss came, and I cried to her. My boyfriend came. I cried to him. I cried to anybody and everybody, and it was a sad day. You know, sad day for anybody when they get that diagnosis. It's a hell of a battle. So, and then in a few days, a day or two, I was supposed to start chemo because they had to, well, that was what I was recommended, but they had to, you know, they did like put like a special line in for the chemo. You had to get certain tests done, like with your heart and your lungs, kind of like markers to see like, okay, this is how you are before chemotherapy, you know, so then they can measure it later and see like, did your heart get worse? Did your lungs get worse? And all that stuff. So, that's my first video of my story of my diagnosis with acute myeloid leukemia. So stay tuned. Thanks, guys.